Every year, millions of seniors over 70 walk into clinics believing they're doing the right thing, getting their routine health checkups. They wait in long lines, fill out forms, and proudly tell their families, "I'm keeping up with my health." But what if I told you that some of these very checkups could quietly harm you? That the tests meant to protect you could actually increase your risk of stroke, cancer, or unnecessary surgery? It sounds unbelievable until you see what the research says. A 2023 report from the National Institute of Senior Medicine found that 37% of medical tests in adults over 70 led to treatments or procedures that offered no benefit and often caused harm. Even more shocking, 99% of seniors had no idea they were being over-tested. So today, we're uncovering 5 common checkups after 70 that may be doing more harm than good, and what to do instead. Stay with me until the end because it's not just unnecessary. It's been linked to 5% of all cancer cases in the U.S. It sounds completely harmless, right? A quick scan, no pain, no needles, just a picture of your bones to make sure you're safe. But here's the truth. After age 70, bone density scans can create more fear than benefit. DEXA scan measures bone mineral density to diagnose osteoporosis. However, as we age, some bone loss is normal. The scan often shows low bone density, even when bones are perfectly healthy for your age. Doctors then prescribe medications that can lead to jawbone decay, esophageal irritation, and even brittle bones that break more easily. Basically, what's happening is this. The scan detects a number that looks alarming, and you're labeled at risk, even when your body is aging normally. A 2021 study followed 200 women over 70 and found that bone medications reduced fracture risk by only 0.3% after 5 years, but side effects occurred in 22% of users. Rose, a 76-year-old retired piano teacher, went for her yearly scan, got diagnosed with osteopenia, and was started on medication. Within months, she developed jaw pain and reflux so bad she stopped playing piano. When her doctor switched her to natural therapy, vitamin D, resistance band workouts, and calcium-rich foods, her pain faded, her legs strengthened, and she never fractured a bone. If you haven't had fractures or major falls, skip repeat DEXA scans. Focus on strength training, vitamin D, and balance exercises. You forget names, misplace your keys. Naturally, you worry. Is it dementia? Your doctor says, let's do an MRI to be sure. But here's what no one tells you. Most brain MRIs in people over 70 show abnormalities that are totally normal for age. The scan might reveal white matter changes or shrinkage, findings that sound scary but don't mean disease. Yet once seen, these findings spark panic and often lead to unnecessary spinal taps, biopsies, or medications. A 2021 study analyzed 3,000 MRIs of seniors aged 70-85. 86% showed abnormalities. Only 3% were linked to any treatable cause. That means 97% of seniors left more anxious and sometimes more sick than before. George, a 74-year-old retired engineer, began forgetting names and went for a scan. It showed mild brain changes, and his doctor mentioned the word dementia. He panicked, quit driving, stopped seeing friends, and fell into depression. Months later, a simple cognitive test revealed his memory was completely normal for his age. Basically, what's happening is this. The MRI shows aging marks, but those marks are being mistaken for disease. If you're noticing mild forgetfulness but still functioning well, start with a cognitive screening test. It's quick, non-invasive, and far more accurate in detecting real memory issues. Focus on sleep, hydration, mental exercise, and social connection. It sounds logical. I'm tired lately. Maybe I should check my heart. Your doctor orders a treadmill stress test or gives medication to simulate exercise. Seems safe enough, but for many seniors, it's a trap. Studies show that in adults over 70, false positive results, tests showing a problem when there isn't one, can happen up to 40% of the time. Those false alarms lead to angiograms, stents, or bypass surgery that often don't extend life, but can absolutely shorten it through complications. A 2017 study found that over half of all stents placed after stress tests were unnecessary and offered no survival benefit compared to medication and lifestyle care. Raymond, a 75-year-old postman, was active, walked daily, but mentioned feeling a bit tired going uphill. His doctor ran a stress test. Results were abnormal. He was sent for a catheterization, then a stent. But the fatigue didn't change, because the problem wasn't his heart. It was dehydration and mild anemia. Meanwhile, the stent procedure triggered kidney issues from the dye used. Basically, what's happening is this. The test mistakes normal aging changes for heart disease, leading to risky interventions. If you're not experiencing chest pain, breathlessness, or fainting, skip the treadmill test. Ask for a resting EKG or calcium scan instead. They're safer, lower radiation, and more precise. We've been told for decades that colonoscopy saves lives. And yes, it does, up to a point. But after age 70, and especially past 75, the risks start outweighing the benefits. Bowel prep causes dehydration, dizziness, and kidney strain. The anesthesia increases risk for confusion, falls, or heart rhythm changes. And the procedure itself can lead to bleeding or perforation. A massive 2019 study tracking 1.3 million Medicare patients found that for every 1,000 colonoscopies after 75, only 2 lives were saved, while 20 people suffered serious complications. Dana, a 73-year-old bakery owner, learned this the hard way. She'd had 2 clean colonoscopies before. Her new doctor insisted on another, just in case. During the procedure, her colon tore slightly, leading to emergency surgery and weeks of recovery. Basically, what's happening is this. We're chasing early detection long after the risk window has passed, and paying for it with our health. If you've had clear results before 70, you likely don't need another colonoscopy unless you have symptoms like bleeding or major changes in bowel habits. Ask about the FIT test, a non-invasive stool test you can do at home. It's 90% as effective for detecting serious issues, with 0 risk and no sedation. Now, let's talk about the most dangerous and overused test of all, the full-body CT scan. It's marketed as peace of mind. You see the ads, detect cancer early, or get your total health picture. But the truth? These scans expose your body to massive doses of radiation, equal to 500 chest X-rays in a single sitting. And studies now link them to as many as 5% of all cancers in the U.S. A 2023 analysis revealed that full-body scans often detect harmless cysts or nodules. But once spotted, they lead to biopsies, surgeries, and radiation that can do far more damage than the original finding. Marcus, an 80-year-old retired teacher, took one of these preventive scans because his family insisted. The scan showed a tiny nodule in his lung, harmless but labeled suspicious. He underwent a biopsy, which caused bleeding, infection, and months of anxiety, all for something that would have never affected his life. Basically, what's happening is this. You're not catching disease early, you're catching normal aging and turning it into a medical crisis. These scans should be reserved for people with specific symptoms, not healthy seniors. The best prevention remains the same as it's always been. Good food, good sleep, regular movement, and joy. So next time your doctor orders a test, just to be safe, pause and ask, will this change my treatment or will it only increase my worry? Because sometimes protecting your health doesn't mean doing more. It means doing less, but doing it smarter. If you're over 70 and want to stay truly healthy, focus on what strengthens you, not what scares you. Eat real food. Move gently every day. Keep learning, laughing, and loving. That's real medicine, and it never harms.